Medical marijuana is becoming more prevalent in California and in Oregon.
Newswatch 12's Amy Sinecki is here with a look at how the medical marijuana programs are working in California and Oregon and how they could change in the future.
An increasing number of cardholders say they are benefiting from medical marijuana. In 2000, there were only 600 cardholders in Oregon. Since then, the number of medical marijuana patients has dramatically increased every year. As of October 1st, almost 24,000 people have had medical marijuana cards in the state of Oregon. In California, that number is less than half. At the end of September, there were only 10,144 valid cardholders in the Golden State.
I think that all of these illegal growers who are taking advantage of the system that we have, they're giving the regular growers, the people who are abiding by the law and following the letter of the law, they're giving those people a bad name and giving medical marijuana in itself a bad name.
Oregon HIDA, which stands for High Intensity Drug Trafficking Area, says medical marijuana is abused extensively in the state.
Most people have well over the legal amount of plants they can have. You see cases where people have medical marijuana and they're selling it at street-level prices as opposed to giving it to their patients as medicine.
But medical marijuana patients like Melissa Fritz, who runs Rogue River Herbal Pain Management Center, says many people do abide by the law.
Herbal Pain Management Center, this is Kim.
Fritz sees the benefits of medical marijuana firsthand.
For me, I was taking prescription pain medications 3 to 4 times a day, and I have younger children, so it was hard for me to be able to get up off the couch and perform my daily functions as a parent when I'm loaded on prescription pain pills.
Fritz started using weed when she was 19 to help alleviate her back pain.
I started smoking and I, within 15 minutes, felt instant relief. And I have a really bad back and really bad sciatic pain, as well as many other things. But that's mostly what I use it for, my back and sciatic pain. And it's a muscle relaxer, it's an anti-inflammatory, it's a pain reliever, and it provides all of that for me.
Oregonians can get a medical marijuana card if they have a qualifying condition. Those include cancer, severe pain, and HIV.
The only things that aren't covered by the program right now are what the program terms as mental illnesses, things like bipolar, anxiety, depression, ADD, ADHD.
The next push from the medical marijuana community in Oregon is to legalize dispensaries. Right now, there are a number of medical marijuana clinics in the state where people can see a doctor and get a medical marijuana recommendation, but clinics cannot actually sell the medicine.
Under law, Oregon law right now, it says that you are not allowed to sell or dispense marijuana. And so it kind of leaves patients who are new to the program or who can't grow it for themselves, it kind of leaves them exposed as to, well, where do I go to get the medicine?
That's why the National Organization for Reform of Marijuana Laws in Southern Oregon is working to collect signatures for a ballot initiative that would legalize dispensaries in Oregon. It's called I-28, and it proposes a state-supervised supply program to help patients get marijuana without having to grow it themselves.
I think that there's no way to stop the progression of medical marijuana. I mean, it goes back forever. And so I think that the more we embrace it and the more we take advantage of the fact that it is becoming legal, the better off we'll be, because then we'll be able to make money off of it legally to where we're able to, as a state, sustain ourselves.
Sustainability and profitability are two of the driving forces behind some of the proposals to further legalize marijuana in California. Assemblyman Tom Amiano, a Democrat from San Francisco, is trying to put marijuana on the same playing field as alcohol. He wants to legalize, sell, and tax it. Amiano says it's nonsensical that California's largest cash crop is unregulated and untaxed when the Golden State is struggling to survive financially.
I'm sure it will lower the prices on everything, but it's already expensive anyway, so I think it would be a good thing. Yeah, I'm not sure what all the legal ramifications would be for it, but it would definitely be good.
This Green Heart Collective in Mount Shasta has only been open a couple of months, but it already has almost 400 members.
Take them back to the medicine room and they can check the medicine, see what they like.
But some people are weary about the medical marijuana industry. Local law enforcement says medical marijuana grow sites are targets for crime.
Violent assaults, kidnaps, robberies, things of that nature.
Police say there's no system of checks and balances when it comes to medical marijuana.
For instance, you could be driving by and see them standing over a fence, but they're not going to allow they don't have to allow you on your property to see the plants and make sure that they're in the legal limit.
Which makes it difficult for police to make sure cardholders are abiding by the law. Under Oregon law, any MD or DO, doctor of osteopathy, can recommend medical marijuana to a patient. It's similar in California. There, any doctor licensed by the California Medical Board or the Osteopathic Board of California can also recommend medical marijuana to a patient.
All right. Thank you very much, Amy.